Hi, my name is Deja, and this is Unapologetic Black Minds, Teens and Mental Health. This is a podcast created to help release the stigma of mental health on teens in the Black community. Within the community, there's always the idea that teens can't go through mental health issues because they're so young. There are times where myself, a friend, or a family member were told that we don't have a disorder or our concerns were not taken seriously, preventing diagnosis for a really long time or ever. On this podcast, I'll be discussing disorders and giving you information about them to hopefully release that stigma. Today, we'll be talking about anxiety. What is anxiety? Well, anxiety is a feeling that we all get. According to the National Institute of Mental Health, it is the occasional worry about different aspects of our lives, like our health, income, families and friends, school, etc. When our anxiety becomes more frequent and starts to impact our daily lives is when it becomes an issue. Anxiety disorders are disorders in which your anxiety has gone from typical, occasional worry to pathological and maladaptive. Aspects that shift from typical to pathological include intensity, or how much anxiety you're feeling, duration, or how long your anxiety lasts, and pervasiveness, or how much it impacts your day to day. Basically, with anxiety disorders, worries and fears become hard to deal with on a daily basis and result in a number of behavioral responses such as inhibition, withdrawal, and avoidance. Anxiety disorders can come in several types, including panic disorders, social anxiety disorder, specific phobias, and separation anxiety. In another episode, I can discuss these other anxiety disorders more in depth. However, today I will be discussing the most common anxiety disorder, generalized anxiety disorder. Generalized anxiety disorder, which I will simplify as GAD for the rest of the episode, is a constant and irrational worry and fear that a person with this disorder may have due to a variety of situations and stimuli. According to the DSM-5, which is the book used by people in healthcare to categorize and diagnose mental health disorders, it is categorized and diagnosed by a few different criteria. 1. Excessive anxiety and worry occurring more than not lasting at least 6 months about a number of events or activities. 2. The individual finds it difficult to control the worry. 3. The anxiety and worry are associated with at least 3 of the following symptoms. Only one of these symptoms is required for children. Restlessness or feeling on edge, easily fatigued or tired, difficulty concentrating, irritability, muscle tension, and sleep disturbance. Finally, the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. In addition to some of the symptoms that I just mentioned, according to the University of Rochester Medical Center's Health Encyclopedia, children and teens can exhibit certain behaviors such as refusing to go to school or not going to school, lots of stomach aches and headaches, clingy behaviors, constant thoughts about the safety of family and themselves, and more. Now, what does treatment look like? One way to treat GAD is with anti-anxiety or antidepressant medications. Otherwise, treatment comes in the form of various therapies. Self-help therapy methods such as CBT or cognitive behavioral therapy are techniques that are effective in teaching coping skills that can be used in situations that cause high anxiety, helping with relaxation and the management of some of the symptoms according to the Mental Health UK. As a parent, you can help your child with their battle with anxiety by being active in their diagnosis journey. Be involved in their lives, and I don't mean invade their privacy, but ask them questions about their lives and make sure they know that you are there for them if they ever need you. Spend time with them and know who's involved in their care. Sometimes all we need is to feel heard and like we aren't going through this alone. We want to feel like someone cares. Remember, teens can develop mental health disorders too. They aren't faking or trying to get attention, and getting a diagnosis and treatment isn't bad. They need you, and your support is half the battle won. Thank you for listening.